I'm your host, Shar Adams, and this is COVID University, New York. COVID-19 vaccines are finally here. After nearly a year of hundreds of thousands of deaths and millions of cases, many are breathing a sigh of relief because of the new vaccines. But experts say we're not out of the woods just yet. Vaccines don't mean that the pandemic is magically and abruptly over. We're still being told to take precautions like wearing masks and staying 6 feet from each other. And there are so many questions surrounding the vaccines. Will they be accessible to everyone? Are there any side effects? How long before we can get back to normal life? A small group of eligible people, like healthcare workers around the country, have been getting vaccinated, so it's too early to tell just what the vaccine's impacts will be on the country. Even though they aren't widely available just yet, a lot of people have already declared that they likely won't get vaccinated. Black people particularly are skeptical of the vaccines due to centuries of racism in medicine. And that's another aspect of the pandemic that the government needs to account for and address. These concerns are totally valid, and any outreach being done to persuade people to take the vaccines need to prioritize that fact. Experts say that at least 80% of the US population would have to be vaccinated for the pandemic to be over. And although many COVID vaccines are in the works, there are 2 that are available now, and according to the CDC, they're in short supply. The next year will be very important amid the pandemic. With a new president and new vaccines, we're getting to a whole other side of this health crisis, and only time will tell if things will get worse or better.
My name is Mohammed Tusar. I'm an undergrad student studying pre-med at Brooklyn College. And with this COVID semester and the COVID year that we have gone through, coronavirus has essentially stopped me from associating with any of my friends. My mom was worse than Governor Cuomo was her lockdowns, and she really had us at home the whole time, and it really messed with my mental health and how I was able to interact with people, because I would see the same faces every day. And of course, that's my family, but you don't like to see the same faces all the time. And as interactive beings, as humans as we are, we like to be outside. But that's the precautions that my mom took, to the extreme. She didn't want us to step outside for groceries. She's like, it's okay. We have enough to eat for the next 2 months. We're not leaving this house. And whenever we would leave, she would have us in PPE. And I'll be like, yo, the medical doctors don't even have it, and we have this whole suit right here. But she went really above and beyond for us.
My name is Ana Lucia Fuentes. I actually go by the name Lucia, and I'm a professor at LaGuardia Community College, CUNY. So I'm not alone in saying and feeling that 2020 was a pretty tragic year. Even though I suffered a tragic loss myself, I've been very lucky in that I have very, very supportive family and friends, and also in many ways the support of my students, which actually gave me hope and a sense of wanting to keep on going in this year.
My name is Dr. Scott Ratson. I'm a distinguished lecturer at the City University of New York School of Public Health and Health Policy, and I've been there since the beginning of this pandemic. We have looked at the issues that are affecting New Yorkers, and specifically looking at the COVID-19 pandemic's evolution. And I've been pleased, if I can say that we've been able to have a major contribution in that understanding what New Yorkers are thinking and doing at the early phase of the pandemic, and now more specifically in 2021, how they are hopefully making the appropriate decisions to get vaccinated, to protect themselves and their family, to protect the community, and to build back better in this new era of living with COVID.
Early on in March, my husband, who was a psychiatrist, said he wasn't feeling very well. He said he had a bit of a stomach ache, and because of all things I had heard, I was very concerned, and I said, be careful, because this thing is really contagious. Just be mindful. But he was very keen. He always went into see his patients. He didn't want to stop seeing his patients. And then I insisted at that time it was like surfaces, and so I gave him alcohol and the whole bit. At that time, from what I know now, is he was already infected. And in fact, he infected me and my son. My son, who's a doctor, he's a resident right now. He's doing his residency. It was my son who insisted that he take a COVID test. And when he did take the COVID test, he came out positive. And from then on, it was downhill. So it was a shock, of course. It was really tough, very, very tough. Students were amazing. Obviously, they were shocked, but it was just this dynamic that developed where they saw that I was going to keep on going and trying to find ways in which we could make this learning process and what we were doing in our life meaningful in order to continue and to help others that were obviously in really difficult situations.
We have a health communication for social change program. And what's exciting about this at the graduate level, we have students from all parts of careers, some of whom are already physicians that are working in the Bronx, others that are just out of undergraduate wanting to develop community work, others that are looking at ways that we can use communication to affect social change, to make the world a better place. And we believe, we're a school of public health, that health is the common currency that we all share. And nothing has been more important than to see the importance of health during this COVID pandemic. So it's been particularly rewarding to be a faculty member at the CUNY School of Public Health, to be able to have graduate students, other current students and graduates involved with our project that we now call CONVINCE, which stands for COVID New Vaccine Information, Communication, and Engagement. And this initiative, based at CUNY School of Public Health, is aimed to provide the education, is aimed to help give people the information they need to attain vaccine literacy, which we believe is fundamental for a better world.
You know, the skepticism started because of the lack of knowledge, for me, it was that I was like, oh, this vaccine is being rushed. The way that everything is going it feels like it's rushed, right? But when you actually sit down and look at it, they had years of research of other coronaviruses, SARS. So you have those that you can look at, and you can see, since it's in the same family, that it will be able to have similar characteristics, right? So because of that, I have more faith in the vaccine now, and I'm waiting to actually get it because SUNY Downstate actually has openings, but they're giving it to the healthcare workers first before they give it to regular students.
In order to be able to explain how vaccines work, there needs to be a clear and simple sort of explanation of how vaccines are really based on our own natural response to foreign molecules, and that includes bacteria or viruses. So we naturally respond, and so taking advantage of this response, then scientists develop, these diminished particles that don't have the properties of infectivity of the viruses, or they're not pathological, they don't cause disease, but they cause our body to respond as though, But I think that there's no clear explanation of that. I really see, and it's difficult to make it simple.
How we put out information is only one part of this, because information in and of itself does not change behavior. It's people understanding the information, it's people processing the information, it's their ability to share it with others and get clarity. So we've learned in the health communication field that people get this through a variety of sources. The most trusted source for most people still continues to be their doctor, and it could be their personal doctor or a doctor they know. Sometimes they get their information from television. They might get the info, but they might not trust the info. And then similarly, we have that challenge with people that only get their information via mobile devices or mobile sites. So what we're trying to do is come up with what are the ethical core communication messages and materials that people will need to know. What do I need to know to do? And it may seem fairly simple, but first people need to know that COVID is real. Most people in New York do. Most people know somebody who's been positive or somebody who's been sick. But yet, across the whole country, everybody does not agree with this. We've got conspiracy theories. We have other activities that are changing the narrative away from truth and facts.
I did a lot of reading from science journals, and whatever information was out there, I was reading it and I was absorbing it. And that's how you are able to educate other people that don't really get to read those type of papers or won't understand it, because there's a huge gap of why people are scared to take it, because they don't understand the terminology, or they don't understand what it means to get vaccinated, right? As a pre-med, we have to be informed on this, because this is one of our cases that we're going to have to deal with later on. If it's not active, it's going to be a case study of so much type of things we can see in the future, patient is 50 years old, past history, had coronavirus, and we'll be in our 30s and we're, oh man, remember coronavirus? That was 10 years ago. But you see how it's important for us to be informed on it, because it's going to affect us down the line, because like I said before, there's going to be long-lasting issues because of this.
For us, so I work in immunology, and it's so complicated, but then I think, no, but it has to be simplified. And there are always ways to simplify. But I think there's several things that need to be explained more clearly in order for people to be more accepting. And I think that they need to hear it from people in their community as well. And so this is why I've encouraged my students. So right now, my students did another little brochure. It's all on vaccines. And we're just in the midst of getting it all finished and done. And what we want to do there is explain how our system works, how our immune system works, how our defense system works, and how vaccines come from that process. And then the different types of vaccines. And then this idea of herd immunity, which we've heard a lot, but a lot of people don't really, haven't really understood that concept. And so the students themselves have put this brochure together, and there still needs to be some translations made. And then what I'd like them to do is to distribute it within their communities. And this was what we did the first semester as well. And again, the idea behind that was that to empower students to feel that the value in their being educated and an understanding is huge. They have so much access to people that no one else has access to.
In the United States, in January 2021, 2 vaccines have been approved for emergency use authorization. One is the Pfizer-BioNTech vaccine, and the other one is a Moderna vaccine. Now, both of those are what they call mRNA vaccines. So they do not put live virus in. They put a signal that gets the body to prepare for response should they be exposed to the actual virus. Both of those vaccines require 2 doses to get to the 94% plus level of efficacy, what we call it, or effectiveness, or basically meaning it will work 94% of the time. Neither of them should have major side effects, and both of them are, expected to work. These are not mix and match. You don't say, I'm going to take this one, and then if it's not ready, wait for the next one, or 3 weeks, or 4 weeks, or 5 weeks. There is a protocol that they've been approved, and for them to work best, people need to adhere to the recommendations from the city health department, the state health department, the CDC, as well as the physician or group that has delivered the vaccine.
One thing I wish people would talk about more is that no steps were skipped, right? When you're looking at this vaccine, right, a lot of people were like, oh, it's rushed, right? But none of the steps in the FDA process was skipped. The only thing that happened was that the FDA was able to look at cases like Pfizer's cases, BioNTech, right? They were able to look at their cases quicker. Like usually if you submit a vaccine or any medicine to the FDA, right, it usually takes 3 months for them to even accept your application, right? And another 3 months for them to review your application. But in this case, the FDA was specifically assigned to these vaccine candidates so they can actually look at it and make sure that it's valid, because you don't want it to get lost in the paperwork. And that's what usually happens, you know, when you're submitting for these type of things, right? And it's a pressing matter, right? So the FDA was on top of it, right? So we shouldn't think that it was rushed. We just have to appreciate that in a global pandemic where everyone was going crazy, the scientists were able to step up and deliver.
They want to know, is it safe? Full stop. They want to know, you know, is this an attempt to put, you know, a genetically modified organism into my system and be tracked? Is this going to cause, you know, something for, you know, my kids, or lack of being able to have kids? I mean, we get some weird questions when you ask open-ended questions to, you know, random people. If people have those, we need to continue to remind them, though those are not factual. But the piece that is factual is it is safe. It has met the level of safety that was important for the Food and Drug Administration, which has approved all sorts of drugs and vaccines in the past, to have a level of safety that they have the confidence that we're injecting a vaccine into healthy people to protect them against getting sick, and it will work. It's a challenge. The CONVINCE stands for the I, C, and the E are information, communication, and engagement. And the E in engagement is important. How do we engage the communities who've asked us sometimes for the information, but we're only going to be able to give kind of like the scientific or medical points that I've raised with you today. But they need to be able to talk about this in a way that people understand at the time they're asking the questions, whether it's engagement during a sermon, whether it's engagement during a community meeting, during, you know, a school-based discussion, a community health board meeting at the borough level, whatever it might be. We're doing our best to get the information out that this is important, to consider the seriousness, to get people to know that in East Harlem, for example, by our School of Public Health, that there's a vaccine site that's available that you can register via, you know, nyc.gov/COVID vaccine and find out, you know, more information. And most people are eligible or will be eligible, and it's free. So we need to take down those barriers. We need the people to know that this is happening all around the city, all around the United States, and we're doing our best to help get that information out that way. And then think about people. There's 40,000 people that work for the MTA and are working on subways and driving buses and, you know, working in these facilities and maintenance and so forth. All of these people are on the eligibility list too. So we need to get New York back to work. We need to build back better, and we need to build back safer and build back healthier. So we're trying to get the messages out through all sorts of channels, and welcome any of your listeners, anybody that's in the 275,000 current CUNY student population, or the 500,000 that might be just recently graduated. We have an incredible footprint here in New York, and we need everyone to be part in helping build back our society in New York and world with these ethical standards and equity for everyone to get vaccinated. This might be one of the most monumental challenges of our time, certainly the most difficult one in the 21st century. You know, we obviously, New Yorkers made it back from September 11th, which was the first challenge we had this century. But this one is broader and bigger in terms of how we protect every individual citizen one by one with vaccines.
One of the things I really felt hopeful about when this was first happening was the collaboration between scientists from all different places. So, you know, the fact that the Chinese scientists gave the sequence to the World Health Organization, the sequence of the virus, and that enabled scientists from all around the world to work with that sequence. So it was like very, very quickly sharing information. And, you know, I think it illustrates the fact that when the world and when scientists and to some extent some politicians put their efforts into these types of initiatives, things move. Yeah, things move because there is the human potential there. And even though I know that normally it takes a lot longer to produce vaccines, it's usually because you don't have, like, you know, hundreds of very high-end labs working on those vaccines.
America's a funny place. We ask for something, and then when we get it, we get upset about it. So it's like, we just have to pick and choose our battles here. And if we want to go back to a sense of normalcy, we have to do what is necessary for us to get there. I don't mind it being mandatory. We already had things like that before. We have mandatory vaccines that we have to take in order to get into schools, right? Like when you submit your forms to like your whatever health office at your school, right? Like at CUNY, before we came in, we had to give them an immunization records, right? And they had to see all the shots that I got. And if I don't have a certain shot, I'm posing a threat to the whole student body, right? And we got to understand, we live in the city of New York. It's virtually impossible to disinfect New York. It's like we have way too much people in this small piece of areas. It won't be the first time that vaccines have become mandatory. I just feel like this time around it's going to be a lot of pushback to it because there's a lot of political aspects to this now, because it first started as a pandemic, now became a political agenda, apparently, and it sucks that, a lot of people are putting politics into health when we should just be focusing on health, because the longer we look at the politics of things, the longer we're stuck indoors and people getting upset about, being indoors and such forth. Let's just get back to a sense of normalcy. I'm really, I'm really tired of looking at these four walls here.
The vaccine will not protect everybody in society until about 80% of the people are protected with the vaccine. So that means we need almost 9 out of 10 people to take the vaccine, whether it's in New York City or even in the United States. So we need 250 million people in the country to take it. That will confer what sometimes people hear the word herd immunity. I call it community protection, and others do too, that we can protect the community from this virus if we have 90% of our people vaccinated. While we're getting to that number, there is the possibility that the virus still can be transmitted. The vaccine was tested to prevent the severity of the disease, meaning that if you have the vaccine and you get exposed, you can still be infective, but most likely will not get the symptoms that will require hospitalization or could potentially lead to death. That's what the vaccine protects against. It primes your immune system that if you are exposed, to rid of the virus or rid of the symptoms and severity of the virus. We do not know yet if you actually have the vaccine, even from the first dose to the second, and you are exposed, if you still can transmit that virus to somebody in the same room, somebody, by breathing, air in a place that's, you're less than 2 meters away or 6 feet away from somebody. So that's the piece of data, if we can say that we're not certain because it hasn't been tested through the public health epidemiology, which is the term we use for field research to actually look how it is in action. We will have that answer, and many people believe that it will likely be like other vaccines that will prevent that kind of transmission, but it has not been approved by the authorities to do that just yet. Yet, if you are out there listening to this and you have not got vaccinated and you are eligible and you want to protect yourself and family and other people that you will be in contact with, the vaccine is the best protection we have, better than a mask, although you still need to do the mask, and better than the other measures that we have in place today.
Close to me, a lot of people did catch corona because I have a lot of friends and mentors that are in the pre-med area and are actually in hospitals and such forth. And I have one of my friend's mom who was an ICU nurse at Mount Sinai. And if you know, Mount Sinai had the most COVID cases there. So just hearing her experience just made me fall in love even more with this MD route, because you have the chance to save people's lives, and seeing people get better is the best thing. So coronavirus was bad at the start, but it's given me a hopeful future.
The death under COVID was horrific in every way because you have no time for you don't have your family around you, you don't have anything. I had my son. We were both sick, but we were well enough that we could support each other. So somebody took my class for that week, and then the next week I started with my students again. And when I first met with my students, I actually told them, I said, I'm sorry I wasn't here last week. I said, my husband died of COVID, but this is not going to deter us from keeping on. And on the contrary, this is going to give us strength to continue. And so that was sort of the story of 2020. It was just this, ongoing sense of loss, but at the same time of understanding what we can gain under these circumstances. And particularly, I think the main thing that I felt was that I could give the students a sense of what they could give to their families, to their communities, from learning. And from learning, not only, obviously from learning about COVID, but just from learning about science and about society and about how we're immersed and how everything is interrelated. And that's how I moved along, and that's what has given me strength. And that's why I feel today that, I still have an impetus and a desire to work with my students and to continue and to maybe go even beyond that with them.
My name is Shar Adams, and this is COVID University, New York. It was produced by David Hoffman, post-production by Garrett Tiedemann, executive producer Peter Christian Eigner. This is a co-production of the Gotham Center for New York City History and Race Car Radio. Initial funding for this series was generously provided by the Seed Time Fund and Lauren Kramer. If you have feedback for us, you can reach us through our Facebook page or email us at coviduniversity@racecarradio.com. If you like the show, please subscribe now and never miss an episode. Just go to racecarradio.com or find us on any of your favorite podcast apps.